Something else, and then I saw this one in the agenda, and I thought, okay, let's go with this one, because for Rotary to say, Rotary and WHO working to end polio together, again reflects a tremendous honor for our organization to work with you. Within Rotary, I hear always, well, people don't know our role, they don't know what we do, etc. Ladies and gentlemen, last week I was with the United General Special Envoy for Malaria, and all he talked about when I told him I was the director of polio was Rotary International. Rotary, and that's such a fantastic group, and they're doing this and they're doing that. Everybody knows who you are, everybody knows what you've done, and everybody knows what you will get finished and achieve with polio eradication. One of the other things that I always hear from Rotarians about polio eradication is that we've been at it for a long time, and we have been at it for a long time, for 20 years. But ladies and gentlemen, this is an ancient disease. This is a hieroglyphic from 5,000 years ago that shows you man has had a long and difficult relationship with this devastating disease. And the disease over those thousands and thousands of years has accommodated itself to survive anything that man can throw at it. It's tried to stay a step ahead of us. So it is a formidable enemy that you're trying to thwart here in this battle to finish polio, and it should not be underestimated. It's a disease with which we've had a history of thousands and thousands of years. 20 years is actually a blink, and when we finish eradication, it will seem that. Ladies and gentlemen, the other thing I always hear is, why aren't we dealing with other diseases? Well, number one, we are, but number two, polio is an awful, devastating disease. We forget that all the time, and I think it's always important, any time when we speak of what we're trying to do in polio eradication, is to remember the people that are still suffering this disease and the devastation that it brings to their lives, to their families' lives, and to their communities. And it not only causes lifelong disability, as you see in this picture from India, but also can cause paralysis and even death. This is a photograph actually from this zone. It's from California, the last great epidemic in the late 1950s there. It is a devastating disease. And it's Rotary understood this when it saw that, well, for the most of the world, it's a disease which is in black and white now, a disease that we took on old cameras, but not a disease in color. For some of the world, it is still very much a disease in bright color. It's a disease that is still today paralyzing their children. Rotary saw this. Rotary made a promise 20 years ago that the world would eradicate and eliminate this disease. Rotary also promised me I'd have a remote that worked. I should be careful with what I say, because I realize today you have a camera. The last time I spoke in front of Rotarians, there was no camera, and I had a little more latitude. But ladies and gentlemen, the promise that you made back in it was actually as early as 1985, if I remember correctly, was an extraordinary promise to rid the world forever of such a devastating disease. And Rotarians made good on their promise. In 1988, you stunned the world when you announced that you would raise $240 million to combat a disease. Now, today, the other great foundations that are trying to work with you on polio eradication and other initiatives, this may seem like a number that people are getting used to, but in the late 1980s, this was a very, very extraordinary number, just as the $750 million that you've now put into polio is an extraordinary number. The generosity of Rotarians is legendary. But Rotary not only brought its resources financial to the eradication initiative, but it also brought with it its volunteer effort. And I think I'm going to need your help, Steve, to move these. It brought forward its volunteer effort. You brought your army of 1.2 million volunteers to the effort. Here we see Rotarians working to end polio, negotiating access with communities that weren't convinced that this was the right thing to be doing. Here we see the generosity of Rotarians helping us to solve the problems that we face every single day in the challenging places where we're working. Vehicles donated in that case by the Netherlands to help ford the rivers and floods of Nepal. Here, Rotarian volunteers working in Africa, working in India to help rid the world publicly, you put your hands and your hearts into this initiative. That was true leadership, true generosity. The world noticed, and your generosity made a difference. Because today, the promise that you made over 20 years ago has already been fulfilled in the vast majority of the world. Over 100 countries are already polio-free because of the promise that Rotary made 20 years ago. Ladies and gentlemen, this is one of the most extraordinary public health achievements in history. One of the 3 polio viruses that we're tackling have already been eradicated. The strategies work. We can finish the job, as evidenced by this. That is what you have done over the last 20 years, and there's almost no program in the world. I think that's so extraordinary. I always like to try and go backwards the day they're going to thwart me, and then do that again, because I'm always surprised, even myself, when I see it on your nice big screens. But an achievement like this, ladies and gentlemen, is something that no other service group will ever have to show its children and to stand as a legacy for its generosity and its vision going forward. So what's the problem in these last 4 countries? I thought I'd put up this slide here to demonstrate to you that I actually went more than kind of talk about pictures and did some confidence in my epidemiologic skills. But what you're seeing here, I'll probably defeat my purpose. What you're seeing here are in the 4 countries, the last 4 endemic countries of India, Nigeria, Pakistan, and Afghanistan. The dark green is good. The bigger the dark green part of the bar, that means the higher proportion of children of the polio cases that were actually vaccinated against polio, which means the vaccine is getting out there. And if you look at the first one, India, you can see over the last few years now, the cases are becoming highly vaccinated, which means they're getting very close to finishing. If you look at the situation in Nigeria, quite different, and Pakistan and Afghanistan, somewhere in between the 2. And we have to understand this, because this is the key to getting the job of eradication finished. Now, in the case of India, what you see here, we can just have a correlation. Okay, in the vaccine world, what we call this is, now at this point, vaccine failure. They have got extremely high coverage. At this level of coverage, any other place in the world would have stopped polio. So now, what the rest of the world